Menopause here at the Femoral US Facebook page. My name is Dr. Mora, and I'm really happy to be here. I want to take a brief moment to just thank Femoral US for inviting me here and having this space for us to share. If you didn't know before, I am going to talk to you a little bit about menopause and the correlation with the immune system. You may think, what do I know about menopause? It is true that I'm not yet on menopause stage. Nonetheless, I am a physician and I do treat a lot of patients with menopause and its symptoms. Let's start by briefing menopause. I'll give you an introduction. Menopause is due to a hormonal imbalance. And to maybe compare it to something else that is a hormonal imbalance in our lives as female, let's talk about just before when you were about to have your menstrual period. Not all of the women experience this, but I'm gonna say the most. So just like a week before getting your menstrual period, you would get some symptoms, sort of maybe you had some change of moods, or maybe you felt like you could eat the world several times a day. That was me. Or maybe you would feel the room around you becoming really warm and you just got super hot. Or you got the chills for no reason at all. These all were also produced by a hormonal imbalance. On the other hand, menopause, it is due to the normal hormonal imbalance that happens when the estrogen production declines in the body. So this happens as we age. It's actually a natural happening. You can tell the body is getting into this stage of life because you start seeing, as you wrote in some of your comments, there is some fluctuations in your menstrual period. So what does this mean? So you can get a couple of months of having your menstrual period, and then you don't have it for one, and you're like, I'm just delayed. And then you have it for 2 more. And then you don't have it for 3 until it stops completely. It stops completely to come, which in definition, it sounds like a blessing. The medical definition for menopause is the period of the woman's life when they've been a year completely without menstrual period, a year no bleeding. Would you imagine not having those monthly visits? I'm sure you do. Sadly, this so-called blessing, or that I said, it comes with symptoms as well, like the ones I just described about before the menstrual period. So they can come in the form of hot flashes, variation in your weight gain, distribution of fat in the body changes, mood swings, vaginal dryness. It also affects your bone health, and it can give you a higher risk to develop coronary disease. These symptoms, they don't come only on menopause. They can happen way sooner than that. Because as I said before, this production of estrogen declines gradually. It starts around 40 years old. So you can start seeing some changes. Maybe you were already moody, but you can see it in changes in your skin, distribution of fat of your body, worsening of your mood swings or something, you know? And then it continues until you stop having your menstrual period. All of those symptoms continue. And then you maybe add the hot flashes around 50 years old. And then around 60, you completely forget about hot flashes and you're like, finally. But then you have a discomfort of vaginal dryness that it's your constant. And the worry of developing osteoporosis comes to mind. And that is when we have to start thinking about our bone health. From all of the symptoms stated above, I think that the gold medal for the worst symptoms on menopause is the hot flashes. I don't know if you were thinking of it. So it affects from 75% to 80% of all women suffering from menopause. Estrogen plays such a big role in women's body. And the hot flashes is actually the effect of the lack of estrogen in your brain. Wait, I'm not saying this is all in your head. But in fact, your body temperature is not increasing. It's just your brain sending the signals that you have to cool off. Okay? For some reason, the lack of estrogen in the brain, besides a lot of things, other things that it produces, it also gives the feeling to the brain that it needs to cool you off. So how do we cool off normally in regular conditions when we're not in a menopause situation? For example, when we're jogging or when we're exercising, the way for the brain to cool you off is by sweating. Same thing. Another situation where the brain is making you feel something that might not be happening, it's like when you have a moment of embarrassment and you feel your cheeks blush, they get all pink or red. I don't know how bad is your blushings. And you kind of feel this heat going up your face. Same exact thing. Brain feeling embarrassed. My apologies. You must be thinking, but I do feel something when I have a hot flash. You do. Your brain is actually sending that signal for you to have all those happenings. Another thing that comes with hot flashes is, for some patients, is that they turn all red from the neck and the face. This is also the brain sending some signals to the blood vessels to dilate. And in that way, it brings blood to the surfaces of the skin, and that's why we look red like tomatoes. The inner body, or let me explain it differently. This air conditioning and heating system inside your body that is controlled by the brain is called the thermoregulating system. The body takes a lot, actually, most of its energy in regulating this system. It is the most consuming system in the body. Do you know what is the second most energy consuming system in the body? Yeah, the immune system. The immune system is like the army of the body. It's the system that defends ourselves when something from the outside is gonna come and try to harm us. Say bacteria, virus, fungus. Since we have a limited amount of energy, if the body uses all the energy it has to regulate this thermoregulative system, then it doesn't give a lot of energy to the immune system to do the work. So we need to really support our immune system so that we don't leave our equilibrium unprotected. So you may ask, how do I protect my immune system? How do I help it be the best army it could be in the body? Of course, I mean, you've heard this before from your mother, maybe when you were a little kid or in things you've read. But having a friendly diet that includes fruits, vegetables, food rich in vitamin C, fiber, supporting liver detox, gut health, and drinking a lot of water can come a long way to defending your immune system. But in the developing stages of menopause per se, and after the menopause, it is key for you to balance your hormonal imbalance to keep your immune system afloat. So I want to share with you what I found to be most effective in hormone health, and especially in the case of estrogen decline. As a woman and a physician who helps women balance their hormones and get rid of the symptoms that come with the imbalance, I recommend all my patients to take a 3-step approach to their hormonal imbalance. Okay, so that would be diet, that I said above. Lifestyle, we need to move. We need to do some exercise. I know sometimes we feel like we don't have the time, but anything is better than nothing. 5 minutes of anything, it's better than nothing. And lastly, supplements. I know that you have heard many solutions online. Maybe you've read several articles. Believe me, I've read it myself to find solutions for myself and for my patients. I will only talk here about science-based solutions. There are many things that I found online, but I will only talk about products that have real clinical studies on human. I'm going to reduce these options in 2 categories. We have the natural ones and the synthetic ones. Okay? And all of these, nonetheless, reduces me to only 2 options of products. On the synthetic side, we have hormones. In the natural ones, completely natural ones, we have Femerel. These 2 have enough science backing them up to take them in account for this lecture. Both of these options, the hormones and Femerel, have things that bind them together or that makes them alike. Obviously, they both treat menopause effectively, and by that I mean it works in a very short period of time after you start taking it. They both work successfully on 80% of the women that takes it. So from 10, 8 are going to feel that their symptoms are being relieved. They also have major differences. Hormones, as I said, are synthetic and are mostly produced from horse urine. Femerel is a complete natural product, and it's an extract of proteins from the soy plant. Hormones are allowed to be taken only when you already reach the menopause stage. And they're also, you should only take them for a little bit of time, which that doesn't work. You don't want to get back to your symptoms. And also, in the long run, you want to think about your bone health. That's for another lecture. Femerel, on the other hand, it has proven that it is safe to take before, during, and after menopause appears. Hormones have a lot of contraindications. One of them, for example, is it cannot be taken by women with coagulation problems. Femerel has a safety study that shows that it can also be taken by these women as well. Lastly, to not make this too extensive, because they do have a lot of differences, and maybe the most important of their differences is that hormones are related to higher in the risk on developing breast and uterus cancer. Femerel is not only proven, but it is used by worldwide renowned gynecologists around the world on their cancer survivors, breast and ovaries. It is safe to use in patients that have family history of breast and uterus cancer. You know, when I was reading, I found this that the European gynecological president said, which I agree. It is like the perfect solution because it gives you all the relief that hormones give you without all the side effects or the risks that hormones can produce in your body. Like you, I was browsing online, looking for answers, and I bumped into this product. And I started giving it to my patients. And after seeing the results and, of course, double checking the science behind it, I actually feel very comfortable in recommend it. I even give it to my mother. If you're not doing so already in a different window or like a separate window while you hear me speak, you can go to their webpage, femoral.us, or look for them in Amazon, and you will find 3 presentations of Femoral that accompanies the woman in all of these 3 stages of their life. The period before getting the menopause, the menopause, and the post-menopause. You're going to find them like this. I have them because I had them at my clinic to give to my patients. They actually go more like this. This blue one, Femoral Rejuvenate, I give to my patients around the age of 40 that starts having the symptoms but have not had flashes yet. So they usually come with symptoms like skin changes. They see like some wrinkles here in the skin, or maybe the fat distribution. Some of them come with the thought that they're gonna kill their husbands, like throwing a pan at them or something. For them, I give Femoral Rejuvenate. Then we have Femoral Recharge. Femoral Recharge is the one that I give to my menopausal patients, the ones that are already on menopause and the ones that have like hot flashes. They're like 1 to 7, it doesn't really matter. This one, in a month of use, I have seen that it actually lowers the amount or even completely stops the hot flashes. Lastly, this one is for my patients around 60 years old. This one is Femoral Unstoppable. And this one, my patients on 60, they don't think about the hot flashes anymore. But they do still have hormonal imbalance. And the risk for them the most is bone health. One of the most interesting studies that I read about Femoral is that they actually produce the activation of cells to produce new bone. It makes new bone formation. They also added in the box, or in this product, vitamin D and calcium to support those cells that produce bone to have the raw material to actually build the bone. It also aids in vaginal dryness, but a secret here, they all do help with vaginal dryness. To the end of this lecture, I just want to congratulate you all to be here and to join me in this lecture. It is important to understand what is going on, and those are the first steps to feel better. On the other hand, the other steps to feel better is to take action on it. So I have a little bit of surprise for you. The guys from Femoral US have given me some free samples, to the first 10 women that send a direct message on their webpage. That is femoral.us. So it looks like this, femoral.us. Please write them your name, your phone number, address, and your most bothersome symptom. Hot flashes, whatever that is, the mood swings. And if you can, and you're okay with it, maybe your age. Especially if you're over 60, because in that way, they can send you some bone savior, Femoral Unstoppable. Please, if you have some time, send through the direct messages on this Facebook page any questions that you have, if there's any topic that you want me to discuss next time we are reunited together. Or also, write some comments below this video or this live so that I can make a little list of the things that I'm going to talk or discuss on our next lecture. For all the topics that I didn't touch today from your messages before, It's because some of them just didn't go specifically with the introduction of the topic, but I will have them in mind for next time. Thank you so much for being here, and I'll see you next week.